Hi guys, welcome back. Today we'll be talking about muscle spindle and Golgi tendon organ, which are the receptors present in the muscle. So what is a muscle spindle? Spindle is a receptor to sense the stretch and length of the muscle. So it is a spindle shaped or fusiform shaped receptor which is present in a capsule, encapsulated, and it is arranged in parallel to the extrafusal fibers. So extrafusal fibers are the fibers which contract voluntarily, and the intrafusal fiber is nothing but the muscle spindle. And it has two parts. One, the peripheral part of the muscle spindle is contractile, and the central part is non-contractile, and this is the receptor part. And it detects one change in the length of the muscle and how fast this change is occurring. So velocity of shortening and change in muscle length are detected by the muscle spindle. Coming to the structure of muscle spindle, there are two types of intrafusal fibers. One is a dilated fibers called as nuclear bag fibers. Another one where nuclei are arranged in a series, so that's called as nuclear chain fibers. And the nuclear bag fibers are two types, one type 1 and type 2, and they detect dynamic stretch type 1, and type 2 receives the static stretch, whereas the nuclear chain fibers only detect the static stretch. So this is the nuclear bag fiber, the dilated central part, and this is the nuclear chain fibers. Coming to the innervation of the muscle spindle, it has both afferent and efferent innervations. So even though it is a receptor, it is having both afferent as well as efferent innervation. So the afferent innervation is primarily by two neurons, 1A and 2. 1A is called as primary afferent and 2 is called as secondary afferent. If you see here, the 1A primary afferent is forming a spiral around the nuclear bag as well as the nuclear chain, and those are occupying the central part, and we are calling these as annulospiral ending, and 1A is supplying both nuclear bag as well as nuclear chain fibers. So it is occupying the center of intrafusal fibers. We are calling them as spiral endings, and it supplies both bag and chain fibers, and it senses dynamic stretch. Coming to the secondary afferents, which are type 2 fibers, and these are having endings called as flower spray endings, and they are innervating only nuclear chain, and they sense only static stretch. Nuclear bag fibers will sense both dynamic as well as static stretch, but nuclear chain fibers will only sense static stretch. Efferent innervation is by gamma motor neuron. We already know that alpha will supply extrafusal fibers, that are the normal muscle fibers, whereas gamma will supply intrafusal fibers. And we already know that there are two components, peripheral part of the intrafusal fibers and the central part. Here the peripheral part is contractile and that is supplied by gamma. That means if you consider this as the spindle, the peripheral has contractile part and this is innervated by gamma. So here you can see the gamma is innervating that. Whenever gamma is stimulated, these contractile elements will contract and pull the central non-stretchable part, so that stimulates the spindle. So dynamic, there are two types of gamma neurons, dynamic and static. Dynamic will form plate endings and they will supply nuclear bag type 1, whereas static will form trail endings and they will supply both nuclear bag and nuclear chain fibers. And this efferent innervation is also by beta neurons. They are also again dynamic and static. So what is the function of muscle spindle? The prime function is stretch reflex. So whenever a muscle is stretched passively, the intrafusal fibers are also stretched, and then these will carry that information through primary afferent to the spinal cord, where it is innervated by where it innervates, it stimulates the alpha motor neuron that causes extrafusal fiber contraction and muscle contraction. So whenever there is a sudden stretch of the muscle spindle is stretched, so 1A is stimulated and that causes activation of alpha motor neurons and muscle contraction. This is a dynamic reflex which is stretch reflex. So our knee jerks, ankle jerk comes under this. Now we'll see what happens if gamma motor neurons are stimulated. Let us think that gamma motor neurons are stimulated. The peripheral part of the muscle spindle is stimulated and it contracts, which stretches the central part of the spindle, and the information is carried through 1A and it stimulates the alpha. It causes muscle contraction. So now if alpha is directly stimulated, that causes muscle contraction, and muscle contraction can also occur by the stretch of the spindle, which increases the 1A afferent discharge. Also the stretch can be done by gamma. Now we'll see here the impulse in 1A fibers. So when in a resting muscle, when the muscle is not at all stretched, there is a afferent discharge which is of low frequency. Now we stretched the muscle. Now the discharge increased because the stretch is causing the muscle spindle activation. Now we directly stimulated the gamma efferents, so which again causes the stretch of the muscle spindle because the edges are contracting. So that also increases. Now if we simultaneously causes muscle stretch as well as gamma stimulation, you can see here there is increased discharge. This is what we'll see in upper motor neuron paralysis, where gamma motor discharge is more and you just hit the tendon, it gives an exaggerated response. So spindle response, there are two types as we said. So here is the muscle length, it is suddenly increased. So it is passively stretched. So this is the dynamic event. Now when you check the discharges from nuclear bag fibers, they are high. But if you compare with that nuclear chain fibers, not that much. Now, so nuclear bag fibers will give you maximum dynamic response. Now coming to the static response. Now if you maintain that length, this is continued stretch. This causes the activation of secondary afferents, that's two fibers, in the nuclear chain. And you can see that there is increased discharge in nuclear chain fibers. Now the stretch is over. Again you can see there is discharges decreases. So dynamic response primarily activates nuclear bag and nuclear chain fibers by activating 1A afferents, whereas static response will cause 2 afferent activation, mainly nuclear chain fibers. Now coming to the control of gamma efferent discharge. As we already mentioned, descending pathways decides whether to give more gamma discharge or less gamma discharge. So usually descending fibers will supply both alpha as well as gamma. If alpha is activated, that causes the contraction of the muscle. If the gamma is activated, that causes the contraction of muscle spindle, which in turn again causes the contraction of muscle. Then the gamma discharge can also be increased by a maneuver called as Jendrasik's maneuver. Usually while we eliciting the deep tendon reflexes, if we don't get the reflex, we'll ask the subject to hook his fingers and pull them apart. When this is occurring, that increases the somatic discharge, which stimulates the supraspinal centers to give increased gamma discharge, so the reflex is exaggerated. Alpha gamma co-linkage. Okay, now when a muscle is contracting, that means muscle has undergone shortening. So when the muscle has undergone shortening, now the muscle spindle is not stretched. So no stretch on the muscle spindle. If there is no stretch on the muscle spindle, means there is no 1A afferent. But still we need that muscle spindle to give 1A afferent to continue the contraction, to maintain the tone. So what we will do is, the gamma also will now stimulate the ends of the muscle spindle. So the muscle is contracting. Now the gamma is also giving the discharge to the spindle ends. Both will link together to cause furthermore continued contraction. So muscle spindle adjusts the motor neurons discharge throughout the period of muscle contraction. That means if the muscle length is shortened, that means it is not stoppage of gamma. Gamma discharge will also continue because of alpha gamma co-linkage. And coming to another receptor that is present in the muscle, that is called as Golgi tendon organ. It is present in the tendon and it lies in series with muscle fibers. As we know that spindle will be lying in parallel to the muscle fibers, Golgi tendon will be lying in series, and it is having only afferent, which is 1B afferent. Now, whenever the Golgi tendon organ is stimulated, it sends its information to the interneurons in the spinal cord, usually which are inhibitory, and they will inhibit the alpha motor activity. That means inhibition of contraction, simply relaxation. So what is happening, we'll see. So whenever a muscle is contracted, you can see here there is increased discharge from 1B. So if the force of contraction is more, to prevent the damage to the tendon and the muscle has to relax. So up to certain extent muscle can hold. If it is beyond that force, Golgi tendon organ will be activated, and that causes inhibition of the alpha motor neurons. So relaxation of the muscle occurs. So in a muscle, to summarize, there are two receptors, muscle spindle and Golgi tendon organ. So whenever muscle spindle is stimulated, that depends upon stretch. So length. So it gives length and velocity feedback, and it has a stimulatory effect of alpha, and it causes muscle contraction. Okay, when you stimulate the Golgi tendon organ with increased force, this causes inhibition of alpha motor neuron. So relaxation. So Golgi tendon organ will sense force feedback, whereas muscle spindle will give length and velocity feedback. And this muscle spindle is also controlled by gamma. Thank you for your patient listening. Bye.